My name is Jamie Renbarger. I'm the division chief for the Division of Pediatric Hematology Oncology, so that's our Pediatric Blood and Cancer Center, as well as the Caroline Symmes Professor for Cancer Research.
The Caroline Symmes Foundation has allowed us to raise funds for an endowed chair. It's also allowed Dr. Jamie Renbarger to build one of the first precision medicine programs in the United States.
Precision genomics, is one kind of term or one name for really what I think of as personalized approaches to treating individual patients. When you bring in the genomics word, that often implies or indicates that we're using some kind of genomic information together with other clinical factors about an individual patient to really help drive care.
I think what really distinguishes Riley's precision medicine program is Dr. Renbarger and her team have really developed a very robust program that includes the use of preclinical models, the evaluation of novel therapeutics in the laboratory, the development of early phase 1 clinical trials for cancers where there is otherwise very little hope. These programs are expensive to get up and going. They cost more than we can get through grants from the National Institute of Health.
Funding from the Caroline Symmes Endowment has been really critical to the work that we do. It has helped us to grow and develop a group of investigators that are all focusing on a common mission, and they're all really passionate about this population. And so that is bringing our program really to the forefront of research in this area. We clearly see novel treatments that we're going to be bringing forward to patients in the setting of clinical trials, all aimed at avoiding that relapse altogether and improving outcomes. So I really feel like things are moving so quickly now, and we're finally getting to the point where we're able to make informed decisions about how to bring therapies together that we're going to be able to bring to patients in the very near future. I think it is a super exciting time to be a part of cancer research, and especially precision medicine focused cancer research. So we really feel fortunate that we're in a position to develop a program like this, and it really would not have been possible without this support.
Our daughter Caroline could light up a room with her smile, and she loved to party.
And in 2 days, she should be turning 14. Instead, at the age of 5, she lost her life to cancer. When Caroline's cancer returned after her stem cell transplant, the doctors looked at both of us and said that there was nothing left to be done for her. There had never been research done on this type of aggressive tumor, that there was no funding for that type of research, and therefore we were without hope. There was nothing left for her to do but die.
Oh, you think about it every day. I mean, think about all the little things that she never got to do. She never had a sleepover. She never had a boyfriend. She never got to play on a soccer team or a basketball team. I mean, just every day you think about these things that our other children are doing that she never will get to enjoy.
It changes everything.
My son Cooper was diagnosed with B-cell ALL, Philadelphia chromosome positive, when he was 11. He was hit hard. Just a few years prior, they didn't have a drug for Philadelphia chromosome positive. They do now because of research. And so when someone says to me that pediatric cancer gets 4%, that's a disgrace.
So for someone who is interested in donating to pediatric cancer research, I would say that your investment makes such a difference in our future, right? In the future of our kids. And without support like this, we can't move forward with key research programs that help us to really improve outcomes in kids with life-threatening cancers.
Yeah, without money, research can't be done, and without research, kids will die. And it's really as simple as that.
I think everyone would donate to pediatric cancer research if they spent one day on that floor. To watch these kids go through what they have to go through, we have to do better. We can do better.
One of the things my girlfriend said when she would go up on the floor is she would say, I would look at the closed doors in that oncology unit and I would know behind every closed doors there was a story. And I can tell you that behind those closed doors there are some families that don't have a voice and all they can do is take care of that child. And we're trying to help out these families that feel they don't have voices, and we're trying to raise these funds that are so critically needed so that more kids survive, more kids have good outcomes, more kids get longer lives and great quality of lives. That's what we're trying to do.
We need you to help us fund research so these kids have hope.
That's our dream.